A complaint isn't just some feedback. It's a really critical clinical event. And how you handle those first few minutes, well, that can define the entire outcome, both legally and professionally.
So, picture this. A patient complaint comes in. Someone is upset, maybe they're angry, or even scared. What do you do first? Your immediate reaction, right then and there, is probably the single most important factor that decides if this de-escalates or spirals into a formal dispute.
To get this right, you really need to juggle two things at once: empathy and documentation. Think of it like a two-part strategy. One part is all about human connection, and the other is about solid medical legal protection. So, let's walk through the protocol that can turn a moment of conflict into a chance to actually build trust.
We like to call these the golden minutes. The moment a patient raises a concern, these next few actions are your absolute first line of both defense and resolution.
It really boils down to three simple but critical actions. First, you just acknowledge them calmly. This shows respect. Second, you listen, really listen, without interrupting. That shows you care. And third, you document what's happening. That shows professionalism. Get these steps right, and you immediately lower the tension and take back control of the situation.
Let's look at how powerful the right words can be. A simple phrase like this works wonders. Why? Because you're validating their emotion, their frustration, but you're not admitting any clinical fault. It's empathetic, but it's legally neutral. And what it does is it opens the door for a real conversation instead of an argument.
Okay, so you've handled that first crucial conversation really well. Great. Now, the work shifts, it moves inward. Let's talk about building the factual foundation of your case, which all starts with really careful documentation.
And here's a rule that's, well, it's completely non-negotiable. Every single complaint, whether it's just a quick verbal comment or a formal letter, must get its own internal record. This isn't just a nice to have. It could become your single most important piece of evidence if things escalate.
Now, this documentation can't just be random notes. It needs to be structured and thorough. You have to capture the date and time, exactly who was involved, and, this is really critical, write down the patient's complaint in their own words, verbatim if you can. Then log every single action you take from that point on.
So, once you've started that record, your assessment kicks in. You need to do a quick but really comprehensive review. Pull the patient's file, have a quiet word with all the staff who were involved, and piece together the exact sequence of events. Your goal here is to get a complete, factual picture, without any bias.
Okay, you've listened, you've documented, you've done your homework. What's next? Well, now it's all about how you communicate your findings and, just as important, knowing when it's time to ask for help. It's so important to have a clear escalation path before you need one. Not every little complaint needs a lawyer, of course, but knowing the triggers in advance keeps you from making panic decisions. The process should just be logical. Finish your internal review, and then decide if it's time to bring in a senior colleague, the administration, or maybe your legal counsel. And listen, there are some absolute red flags. The moment a patient even mentions a lawyer, alleges serious harm, or talks about going to the media, the game changes. You stop what you're doing internally, and you immediately contact your legal advisor. Getting them involved early in these cases is absolutely crucial for managing the risk.
Okay, so we've spent a lot of time talking about what you should do, but honestly, what you don't do is just as important. There are a few red lines that, if you cross them, can seriously increase your legal risk.
Think about it, like a fork in the road, right? On one side, you've got productive, solution-focused communication. On the other, you have these high-risk responses that just add fuel to the fire, arguing with the patient, getting defensive, or trying to shift the blame. These things will almost always make the conflict worse.
And this is probably the biggest don't of them all. Never, and I mean never, go back and change the original medical records. If you feel you need to add something for clarity, it has to be a new, separate entry, and it must be clearly dated, timed, and signed. Altering old records looks like a clear sign of guilt, and it can destroy your credibility.
You know, when you follow a good structured process like this, it's not just about playing defense. It's actually about strengthening your entire practice and confirming your professionalism.
So, when you put this all together, what do you get? Well, a really solid process gives you three huge benefits. First, it protects you legally because it shows you were diligent. Second, it protects your reputation by helping to rebuild that patient's trust. And third, it actually improves your whole practice by showing you where your systems can be made better. So, I want to leave you with a question to think about for your own practice. A complaint doesn't have to be a threat.
When you handle it the right way, it can actually become a chance to show just how committed you are to patient care and professionalism. It's truly a core skill in modern medical practice.
Stay informed, stay prepared, and stay protected.